challenges right now would be at an emergency time, the stocks of the things will be maintained either in Excel or they'll have physical records. And they have, I mean, it's going to be a very tedious task to basically track the inventory. Who are the, who are the donors or other things, and how is, they'll have to keep a record of how well is this maintained, and what is my actual inventory looking at. So what we feel is, basically, if there is any blood bank request, that has to be digitally put out in the system. And when we finally find a donor match, and we record those details also, and we record the donations as well, and then that gets updated as our stock. That is, the physical inventory goes up. And our request gets fulfilled. That is, we issue it later when there is a crisis occurs. There is a, blood request put out by an ICU or any other emergency services. We issue for that. But for that, we need to know how many different types of blood groups we have, how much of blood bags do we have, the standard bags or the regular ones. So that information right now, we believe, is in most small and medium scale healthcare units are manual, and we propose to make it digitalized. How do we do it? As I said, we can have a central blood inventory management within Odoo itself, and then which also tracks it with the donors. That is, as an internal healthcare unit, we get to know who has donated this particular bag with the specific serial number, their blood group, and all the details. And then once there is a, basically, if there is a this thing, that is, when there is a stock, when we have to issue, we'll clearly get to know that, okay, whom we are issuing it, who is the patient that we are issuing it. And also, as and when we issue it, the stocks goes low. So auto alerts will be there in place, and also expiry will be there in place, which says that, okay, you have low stock levels, please do please do conduct probably blood donation campaign, or ask more patients to fill in the liquidated stock. So that can also be done. So as you can see on the screen, again, we can have that who are the donors, what are their different blood groups, what are the age, what is their weight, what is the height, and then all the details can be recorded. And once the blood is collected from them, that is, once they donated, the stocks can also be updated. That is, basically, in Odoo, we can have a multi-hospital setup as well. A single holding company can run multiple units of hospitals, and that can also be put out. That is configured in Odoo. And you can have multiple blood banks of your own, and that can also be put out in Odoo as well. So at any point of time, real-time visibility will be available. So as I said, when life depends on blood availability, the system also must be as responsive as the team itself. So rather than depending on manual task coordination on phone or something like that, these things should be digitized in such a way that the decisions are taken quick and also efficient. That's the most important aspect.